Ladies and gentlemen, I'm Oris from Taiwan MIRDC. In order to help the manufacturers in the cluster to cut into the global market, Southern Taiwan Science Park Bureau holds this webinar named Moving Forward to Malaysia, STSP Precision Health Cluster. We invite two experts from Malaysia to share their view in medical device market and regulatory. Moreover, Southern Taiwan Science Park Bureau also set up a medical device operation center in KL, Malaysia. After offer more help for our manufacturers who want to enter Malaysia market. So we have a brief introduction about our operation center too. 各位参与本次活动的厂商先进，大家好，我是今天的活动主持人庭君，财团法人金属中心的庭君。南科管理局为了协助各位厂商国际拓展，特别举办了本次迈向马来西亚南部科学园区精准健康产业聚落研讨会。会中邀请了2位来自马来西亚的讲者为大家专题分享，其中包含马来西亚医疗器材市场的概况介绍，让大家更了解当地的市场与机会。另外就是大家将产品卖到马来西亚的必经过程，也就是法规与取证这个领域。而南科管理局为了协助厂商进军并深耕马来西亚，于2019年在马来西亚吉隆坡设立了南科马来西亚吉隆坡医疗器材营运中心，透过直接在地链接当地人脉的方式，更进一步将我们的服务层次提升。另外，我们也邀请到了我们在当地的驻点人员杨小姐，为大家进行我们营运中心的一个概况介绍。而画面中的就是本次的活动的议程表，请各位参考。And there is an important thing that if you got some questions for speaker, please leave your question in the Q&A form we offered before. Then it will be discussed and replied during the Q&A section. 提醒各位，在活动中如果有对于讲师的议题有任何问题的话，请在我们预先提供的表单 Q&A 表单或是直播画面下方的 Q&A 表单中留下您的提问。我们将汇整大家的问题，在 Q&A 时间一并进行询问与回复。Now, the speakers from Malaysia are already in our meeting room. The upper left corner is Mr. Khairuddin from MIDA, Malaysia Investment Development Authority. Hello, Mr. Khairuddin.
Hello.
And the upper right corner is Ms. Zhang from AD Consultation Service. Hello, Ms. Zhang.
Hello.
The bottom left corner is Ms. Yang from our Medical Device Operating Center. Hello.
Hello, everyone.
And before the speech starts, we are so glad to invite Southern Taiwan Science Park Bureau Investment Service Division Deputy Director Dr. Chen to make a brief opening remark for us. Let's welcome him.
Distinguished speakers, Mr. Khairuddin, Ms. Zhang, Ms. Yang, ladies and gentlemen, good afternoon. I am Jin Chen, Deputy Director of Southern Taiwan Science Park Bureau. 我陈景玉是南科管理局投资组的副组长。On behalf of the Bureau, it is my pleasure to take part in today's symposium. Moving forward to Malaysia, STSP Precision Health Cluster. And we are honored to invite our distinguished speakers to share with us about Malaysia medical device industry, market, and regulatory. We look forward to these talks. The Southern Taiwan Science Park is one of the most important manufacturing bases in Taiwan and over the past decades. A vibrant medical device industry cluster has formed on our territory. There are currently 87 medical device companies in this cluster. In order to promote the medical device products of our biomedical cluster, the STSP Bureau launched our Medical Device Operation Center in Kuala Lumpur, Malaysia. Kuala Lumpur is the perfect location for the new medical center, since it is Malaysia's capital city and the center of South Asian trade. By establishing an overseas branch, Taiwan's high-quality medical products can be showcased in the South Asia market and eventually to every other continent. We would like to invite everyone present here today to join our team. By holding today's symposium, we invite the experts in Malaysia's medical device market and the regulatory, sharing their valuable opinion to the manufacturers in our cluster. And we also look forward to building the cooperation relation between Taiwan and Malaysia. Finally, I would like to welcome you again and wish you a successful symposium. Thank you very much. 谢谢.
And thanks for Dr. Chen's opening. Now I would like to hand over to Mr. Khairuddin for his topic today. Let's welcome him.
你们午安。Thank you, Mr. Teo Siang, Specialist on Metal Industry Research and Development Center, MIDA, Mr. Chin Wen, Deputy Director, Southern Taiwan Science Park Bureau, fellow speakers, Ms. Teo Siang Ying, Senior Consultant, AS Consultant Services, Sdn Bhd, and Ms. Yong Chin Wen, Marketing Representative, Southern Taiwan Science Park. Good afternoon. I would like to extend my appreciation to the Southern Taiwan Science Park for inviting me from MIDA to speak on the webinar today. It's my great pleasure meeting everybody on virtual today to present business people in Taiwan on Malaysia's medical device industry through this presentation titled Malaysia, the Rising Star in Medical Devices Industry. And for my content today, I'm talking about, firstly, about the MIDA, the first point of contact. Secondly, Taiwan investment performance in MIDA. Thirdly, about medical device industry in Malaysia. And last but not least, why you choose Malaysia. Ladies and gentlemen, MIDA is the first point of contact for any investor who wish to set up business operations here in Malaysia. So we have global footprint with strategic network of 20 overseas offices located in capital exporting countries to attract and facilitate investment into the country. We also have 12 officers in Malaysia to assist investors for post-implementation project and to deal with the local authorities or the state government. And also to further support investors from Taiwan, we have an office in Taipei. I hope all of you present at today's session will take this opportunity to leverage on this virtual platform to engage with MIDA Taipei and explore the vast opportunities Malaysia has to offer to your business. Let us look at the role of MIDA. As the principal investment promotion and industrial development agency of the country, MIDA is the first point of contact for any business people who want to set up your operation in our country. We are and have been instrumental in extracting FDI for more than 50 years since our establishment in 1967. Besides being an investment promotion agency, we provide end-to-end solution, including approval for manufacturing license, investment incentive, expected post, import duty exemption, and we also handhold investor until the implementation of their projects. We also offer dedicated business support and facilitation by engaging with our local stakeholders, such as the talent facilitation, local sourcing, technology collaboration, engineering support services, as well as support local companies in accessing additional sources of funds, particularly in bridging potential financial and technology gaps. Let us look at the approved investment in economy in 2020. Amidst the challenging external environment and declining global foreign direct investment inflow, Malaysia remained resilient. Malaysia recorded a total of 41.5 billion US dollar in approved investments through 4,599 projects in the manufacturing, services, and primary sectors in the year 2020. The manufacturing sector accounted for more than 55.6%, services sector 40.7%, and primary sector 3.7%. These investments are expected to create 114,673 new jobs in various sectors of the economy once implemented. So the top 5 FDI sources last year was People's Republic of China, Singapore, the Netherlands, British Virgin Islands, and the USA. Let us look at the investment in the manufacturing sector last year. In last year, a total of 1,049 manufacturing projects worth 22.7 billion US dollar were approved compared to 20.2 billion US dollar in 988 projects in 2019. Total increase of 12.2% from 2019. These underline Malaysia's competitiveness as the preferred location for high value-added manufacturing activities in the region, as supply chains aligned with post-pandemic. In terms of implemented projects, up to last year, a total of 1,632 manufacturing projects from Taiwan worth 6.7 billion US dollar has been implemented in Malaysia. These projects have created 224,767 employment opportunities in the country. Taiwan was ranked as number 8 largest sources of investment for that period. Thank you, Taiwan. From 1980s to 2020, approved manufacturing projects from Taiwan were mainly focused in the following industries: electrical and electronic, basic metal products, textile and textile products, petroleum products including petrochemical and fabricated metal products. These are the major Taiwan companies operating in Malaysia. Since 1980s, we have seen a lot of well-known Taiwanese companies investing in Malaysia. It's our privilege to see many Taiwanese companies leveraging Malaysia's competitive advantage to expand and to grow. Some of the notable companies are Wistron Technology, All Cosmos, Honor Steel Enterprise Corporation, AUO Sun Power, Hotai Electronics, and YSP Industries. So they are mainly focusing in industries of electronic appliances, medical equipment, and machinery and equipment. Ladies and gentlemen, the medical device industry is among the high growth manufacturing subsector. It is a significant growth area that is expected to re-energize Malaysia's economic landscape through the production of high complexity, high technology, and high value added products. Some of the major medical device companies in Malaysia, Malaysia comprises over 200 manufacturers producing a broad range of products and equipment for medical, surgical, dental, optical, and general health purposes. So the country is the world's leading producer and exporter of catheters, surgical and exam gloves, supplying 80% of the world market for catheters and 60% for rubber gloves, including medical gloves. Today, Malaysia boasts of more than 30 medical devices multinationals leveraging Malaysia as their offshore location to manufacture their niche products. These companies continue to intensify technologies within their manufacturing plants in Malaysia. Malaysia continues to evolve as a manufacturing hub for medical devices in Asia. Multiple renowned medical device companies such as B. Braun from Germany, Boston Scientific from US, Haemonetics US, Cardinal Health have made Malaysia their offshore manufacturing location. Some of the notable companies, let me say Dexcom from US, ranked 8th in the Fortune Future 50. They established its first continuous glucose monitoring, the CGM, system manufacturing plant outside the US in Malaysia to help Dexcom meet the needs of global demand. Secondly, a UK-based company, Smith & Nephew, has also established their presence in Malaysia, set up a facility in the country to support its orthopedics franchise, which has been growing strongly in the Asia-Pacific region. Products are earmarked to be manufactured include knee and hip implants. Ladies and gentlemen, let us look at the investment performance in the medical device industry. Investors are increasingly seeing the appeal of Malaysia as an attractive investment destination, particularly as an outsourcing destination and a medical device manufacturing hub within ASEAN. Since 2016, MIDA has approved a total of 176 projects with investments worth 17.19 billion ringgit in the industry. This investment would create more than 33,000 jobs in Malaysia. In terms of trade performance, Malaysia's medical device industry has witnessed a steady increase in trade performance. In 2018, it surpassed the 20 billion ringgit barrier in exports for the first time in history to reach 23 billion ringgit in 2018 and consequently 23.9 billion ringgit in 2019. Following the pandemic, the industry continues to advance, recording 30 billion ringgit worth of exports in 2020. And the top 3 export destinations were USA, Europe, which include Germany and Belgium, and in Asia was Japan. Major products exported were surgical and exam gloves, needles, catheters, cannulae, instruments and appliances used in medical or veterinary, orthopedics and other appliances worn, carried or implemented in the body, and electrodiagnostic apparatus. While major imports are intravenous, contact lenses, disposable tubes for intravenous, cannulas, orthopedic appliances. Ladies and gentlemen, I'd like to show you a very interesting diagram here, the medical device ecosystem. So when we promote investment, we look at the ecosystem approach. Malaysia's medical device industry has developed to the point of manufacturing complex medical products. The country's value proposition, particularly in well-established supply chain network in complementary industries such as the semiconductor, electrical electronics, metal stamping, and plastic industries. Healthy ecosystems in these industries have also made Malaysia an ideal investment location for procurement of equipment, parts and components when it comes to manufacturing of medical devices. This end-to-end ecosystem is ideal for manufacturers seeking to produce high value-added medical devices and offer supporting services in this niche area. Also appeals to upcoming and innovative industry players. We have strong supporting industries for medical devices, ranging from sterilization services, sterile medical packaging, precision engineering, and tool and die making to contract molding and assembly and machinery fabrication, as well as electronics manufacturing services. Supporting industries that have enhanced the position of Malaysia as an outsourcing destination and global supplier of parts and components for major medical devices and equipment companies. Given the vibrant business environment prevailing in the country, we are optimistic that medical device companies will benefit from the established ecosystem and facilities that Malaysia offers. Let me quote an example. KLS Martin set up their first production facility for surgical instruments outside of Germany in Malaysia to leverage Malaysia's growing medical device ecosystem to develop and produce their niche product solutions for the operating room, such as implant systems, high-frequency surgical devices, surgical lasers, and sterilization containers. It has also established a center of excellence for general surgery and R&D to serve the industry in Southeast Asia. Another company, Boston Scientific from US, a global manufacturer and marketer of cardiology and endoscopy devices, is working closely with our local industries in sterilization, packaging, and chemicals for manufacturing facility. So we have other strong supporting ecosystem, our raw materials, the medical packaging, machinery and engineering support, sterilization, testing, accreditation bodies, research institute and local universities, education training, and NSA groups. These are very important ecosystem. We have those names. So whenever companies come to Malaysia with this complete ecosystem, we know that you're going to stay here and they will feel happy establishing their operation here in Malaysia and to cater for the global market. On the regulatory aspect, we have this Medical Devices Authority, MDA. MDA, don't confused with MIDA, MIDA. We are MIDA, and this one is Medical Device Authority. So with the enforcement of the Medical Device Act 2012, all medical devices manufactured, imported, or sold in Malaysia are required to be registered with the MDA, a body under the Ministry of Health Malaysia, responsible in regulating the medical device industry. The Medical Devices Regulation 2012 is aimed at protecting patients and other customers from substandard and unregistered medical devices. So MDA has exempted for exports only medical devices from registration. However, it must comply with notification requirement as specified by MDA. So why Malaysia? Why do people come to Malaysia? Because we are a multiracial, multicultural, multilingual. We have the Malay speaking, the Mandarin speaking, the Indian speaking, and other languages around the world. So we have a lot of talented people in Malaysia. Malaysia ranks number 25 in the world when it comes to talent ranking. We have more than 20 public universities, more than 40 private universities, 10 international universities, private university colleges, 30 polytechnics, and more than 200 technical TVET institutions here in Malaysia. In terms of location, you know where Malaysia is. We are located in Southeast Asia. Malaysia is strategically located between two big markets, the People's Republic of China on our east side and India on our west side. So with more than 900 kilometers, Malacca Straits that flows 40%, I repeat, that flows 40% of world's trade. It goes to the Strait of Malacca. It's between Peninsula Malaysia and Sumatra, an island belong to Indonesia. So MIDA would like to encourage Taiwan investors to look at Malaysia as a gateway to the enormous ASEAN market and beyond. So ASEAN has the world's third largest level and a growing middle class, a powerful engine for long-term growth. By locating in Malaysia, investors are also able to leverage on the ASEAN Economic Community, AEC. As a gateway to ASEAN and beyond, so Malaysia is a market-oriented economy. Malaysia has also signed 16 free trade agreements and 14 FTAs have been implemented so far, which create a potential market size of 3.9 billion population. More than 90% of products are 0% import duty under these FTAs. On the Regional Comprehensive Economic Partnership, RCEP, so it's being the largest free trade agreement in the world. So it's covering 15 countries with 2.2 billion, or nearly a third of world population. RCEP represents 26.2 trillion US dollar, or almost a third of world GDP based on 2019 data by KPMG. A memorandum of understanding signed on 30 November 2020 by the ASEAN economic ministers to ensure smooth flow of essential goods and prevent supply disruption during the COVID-19 pandemic. The MOU includes a list of 152 essential goods consisting mostly of medical goods such as test kits and equipment. So this will be enacted in 2022. We have business-friendly business policies. The Malaysian government continue to be pro-business, prudent, pragmatic, in our policies to ensure that Malaysia investment climate remains attractive for business. Foreigners are allowed to hold 100% equity ownership in the manufacturing and selected services sector. Foreign companies have no restriction to repatriate capital interest, dividends, and profits. And MIDA process for expected flows in the sectors in the field under the purview of MIDA, also including the T-POS and term POS. On investor security, the Malaysian government upholds the intellectual property, IP protection for economic growth and business prosperity. So we have competitive investment incentive. We offer a wide range of competitive tax incentive for manufacturing projects. The main incentive, as you see on the screen, is the pioneer status, investment tax allowance, reinvestment allowance, and the customized package of investment. So in total, generally, you can enjoy a total of 25 years altogether, depend on the case-by-case basis. And for the manufacturing in the medical devices, presently high-tech medical device manufacturers are eligible to be considered full income tax exemption on statutory income for 5 years if they opt for pioneer status, or investment tax allowance of 60% for 5 years as well. And the government is also offering partial grants for R&D and high-tech technique training for Malaysians to potential investors. And you know, now under COVID, the government has initiated the National Economic Recovery Plan, or we call it PENJANA initiative. We are offering a special relocation incentive until December 2022, next year, for new investments in the manufacturing and services sector, including medical device companies. This includes a 0% special tax rate for 10 years for new investments with capital investment between 300 million to 500 million ringgit, or a 0% special tax rate for 15 years for new investment with capital investment above 500 million ringgit. In addition, existing companies in Malaysia seeking to relocate their overseas facilities into the country with capital investment above 300 million ringgit could also potentially enjoy 100% investment tax allowance for 5 years, or to be offset against 100% of statutory income for each assessment year. So we have good international standing. So Malaysia continues to be a competitive investment destination as it ranked #1 for world best countries to invest by CO World Magazine 2019. See, we rank #1 among 67 countries. We rank #2 for ease of doing business with ASEAN. It's from the World Bank Doing Business 2020 report. So we are ahead of other ASEAN countries such as Thailand, Brunei, Vietnam, and Indonesia. We rank #2 in the Asia Pacific for Global Connected Index report. And also in that case, #2 in ASEAN and 16 globally. We rank #4 in the cost of manufacturing operations around the globe from KPMG 2020 report. We are ahead of developed countries such as USA, United Kingdom, Germany, Switzerland, and Ireland. And #5 on Bloomberg study of 17 developing markets, gauging their outlook for 2021 based on 11 indicators. I think, ladies and gentlemen, given with new incentive initiative to drive, we have already installed the Invest Malaysia portal. It's an online application aimed to help meet investors' expectation through optimal process automation and seamless data capturing analysis. We also launched the Project Acceleration and Coordination Unit, which to facilitate the approval of businesses, particularly manufacturing and related services, to ensure that they successfully implement the project within 24 months. We also established the one-stop center to ease the movement of business travelers by expediting the approval of their entries to do business in Malaysia. This center is represented by MIDA, by us MIDA, Ministry of Health, Immigration Department, to ensure the legitimacy and health status of business travelers before they enter into Malaysia. Ladies and gentlemen, with that, I thank you very much. If you have any question, we can answer later. But we have an office here in Taipei, I mentioned earlier. You can contact our colleague, Ms. Shakila, for any further inquiries regarding investment opportunities in Malaysia, including the medical device. Again, thank you very much. And thank you, and also Chaiche.
Yeah, thank you. Thanks for Mr. Khairuddin's speech and sharing. I think it helps a lot not only for Taiwan medical device manufacturers, but also for those who is considering to invest in Malaysia. And if you got some questions for Mr. Khairuddin, please leave your questions in a QA form we offered you before. And now, we are going to the next topic, which is Malaysia Medical Device Regulatory Update by Ms. Zhang. Let's welcome her. Ms. Zhang, you can start right now. Thank you.
Hi, thank you for being here today. I'm Siang Ying from AD System. I'm here today to talk about the Malaysia Medical Device Regulatory Update for 2021. These are the topics will be covered by today's program: introduction, establishment license requirements, medical device registration requirement, post-market surveillance, time for setting up the establishment license and product registration, fee structure for the license and registration, and also medical device advertising regulation updates for 2019. The current population of Malaysia is about 32.75 million based on the latest United Nations estimates. Malaysian population is equivalent to 0.42% of the total world population. Total manufacturer, local rep, importer, and distributor registered with our local authority are 2,964 companies, and total devices registered with MDA currently is about like 40,000 applications as to date. Establishment license, product registration, and post-market surveillance. These are the key elements under regulatory affairs for medical device. No company shall import, export, or place the devices in the market without holding the valid establishment license. This illustration is showing the enforcement deadline for medical device registration in Malaysia. At the end of December 2012, Act 737 and 738 are gazetted. Medical device regulation is effective since end of June 2013. And then all the companies must be licensed by end of June 2015, and all the devices must be registered by end of June 2016. Advertising Act will be fully enforced by 1st of January 2022, which is by end of this year. Section 15 under Medical Device Act 737 is required establishment to apply for license before it can import, export, or place any registered device in our market. There are a few types of establishment license, for example, like manufacturer license, local rep, distributor, and importer license. Manufacturer is the company who manufactured and placed the device under his own name. Therefore, they have to bear the full responsibility and make the application to register this product in Malaysia. For those overseas manufacturers, they can appoint a local rep to act on his behalf, relating all the regulatory matters with our local authority. AR must be a natural or legal person with business registration in Malaysia. At the same time, AR must maintain the linkage with foreign manufacturer, and they should be able to get the support from foreign manufacturer when it's required. Distributor is a person who appointed by the authorized representative or the manufacturer to distribute the product in Malaysia market. And also for the importer is the company appointed by the AR to bring in the registered device from overseas. In order to apply for the mentioned license, the company need to establish and maintain the certain quality management system. Good distribution practice for medical device is the prerequisite for local authorized rep, importer, and distributor license. For local manufacturing license, they will need to maintain ISO 13485 system. These illustrations show the process conformity assessment on the quality management system. If the company is dealing with medical device, they have to proceed with the conformity assessment on QMS. From manufacturer, they should conduct the audit based on the ISO 13485. Whereas for local rep, importer, and distributor, the audit should be based on GDP-MD. Company shall appoint a CAB to conduct the conformity assessment. Once the company comply with all the requirements, CAB, they will issue the certificate and report for them to proceed with the online application to apply for this licensing under the MYKL. MYKL is our online system for this licensing application. For medical device registration, it's actually divided into a few categories, like general medical device, in vitro diagnostic medical device, and medical device and drug combination. This table shows the risk classification for medical device. Class A is the low risk device, for example, like reusable surgical instrument, bandage, stethoscope. Class B is like low risk to the moderate risk, for example, like breathing circuit, hearing aid, BP monitor. Class C is like moderate risk to high risk devices, for example, like orthopedic implant, ventilator, or radiotherapy equipment. Class D is the high risk medical device, for example, like pacemaker, neurological catheters, or vascular prosthesis. This table shows the risk classification for IVD devices. Class A is a low risk device, for example, like GCMS, LCMS, blood vacuum thinner without anticoagulant. Class B is the moderate risk to low risk to moderate risk, for example, like pregnancy test kit and urine test strip. Class C is the moderate to high risk, for example, like blood glucose monitoring device and strips, dengue test kit. Class D is the high-risk medical device, for example, like HIV, hepatitis B and C test strip. This is the process flow to register the devices in Malaysia. Only Class B, C, and D are required to do the conformity assessment, which is carried out by our CAB. Class A registration is exempted from CAB assessment. Once CAB approved, certificate and report of the conformity will be issued, and we can proceed on MDA registration. Evaluation by MDA will be strictly in accordance to the Medical Device Regulation 2012 and Act 737. Once the registration is completed, the cert will be issued. For those medical devices with recognized with the approval from the recognized country, can be submitted to CAB for verification. For those medical devices without the approval from the recognized country, the full assessment is required to carry out by CAB. This table indicated the 5 recognized country approval, which is recognized by MDA. TGA, Australia, Health Canada, CE marking by European Union Notified Body, Japan MHLW, US FDA. AR and manufacturer shall prepare, collect, and compile all the evidence of safety and performance of medical device, which is include like QMS, PMS, CSDT, and DOC. CAB will conduct the conformity assessment based on these criteria. Once completed, the report and the conformity certificate will be released, and we can submit to MDA. And when the registration is completed, the certificate will be issued and enter the register. These are the parameters to be verified by CAB. Step 1 is to check on the medical device information, for example, like intended use, and indication must be the same as the approved recognized country, correct risk classification and grouping. Step 2 is to check on the authenticity of the manufacturer ISO 13485 certificate, certification scope, and cert validity period. Step 3 is to check on the PMS, for example, like whether or not the medical device has any ongoing incident globally or any incident resolved for the past 3 years and the last audit date. Step 4 is the authenticity and validity of CE certificate. And DOC also must be included as part of the supporting documents. These are the documents required for each of the risk classification. For class B, C, D, CSDT and the supporting documents together with the DOC is required for the MDA registration. The main sections of CSDT consist of executive summary, essential principle checklist, device description, pre-clinical and clinical study, device labeling, risk analysis, manufacturing info. The contents of the DOC, including of the sufficient information on the device identification, which is including device name, brand, model, and identifier. And then risk classification, GMDN code, responsible person, manufacturer info, and the QMS cert validity date. Okay, this is the registration route for the class B, C, and D. For the Class A registration, CAB assessment is can be exempted. For post-market surveillance, establishment shall monitor the safety and performance of the medical device. Post-market obligation, for example, like complaint handling, FSCA, recall will be carried out. Meanwhile, MDA monitors the compliance of the requirements and take the appropriate action in accordance with the Act. When the PMS is properly done, the PMS system can improve the quality of medical device and provide a better service to the user and reduce the adverse event risk. This is the incident reporting timeline. For the event that leads to the serious threat to the public health, it should be reported within 48 hours to MDA. For the event that leads to the death or serious deterioration in health of a person, it should be reported to authority within 10 days. For the recurrence of the event that leads to the death of the serious deterioration in health of a person, it should be reported to the authority within 30 days. For the establishment license issued by MDA, it will be valid for 3 years, but subject to the CAB surveillance audit every year. If the audit fails, the license can be revoked. License renewal shall be made to MDA before it's expired. The timeline for registration, Class A is around 30 days after submission, Class B is 100 days, Class C is 180 days, and Class D is 220 days. When submit the application to MDA, if there's any inquiry raised by the MDA, 90 days feedback time will be given. Registration cert is valid for 5 years once successfully registered. For the establishment licensing application fees for each type of license is 250. The licensing fees for the manufacturer license is 4,000, AR license is 4,000, importer and distributor license is 2,000 for each license. For the renewal, application fees is 200. Manufacturer license is 2,000, AR license is 2,000, the importer and distributor license is 1,000 for each license. These are the charges for medical device registration fees. Class A is 100, Class B is 1,250, Class C is 2,005, Class D is 3,750. For the renewal, Class A is 100, Class B is 1,000, Class C is 2,000, and Class D is 3,000. The Medical Device Advertising Regulation 2019 were approved and published in the Gazette on 15 November 2019. This regulation prescribes the method of control the medical device advertisement under the Section 44 of the Medical Device Act 737. This regulation details out the condition and requirement of the content of medical device advertisement. With the gazettement of this regulation, all medical device advertisement shall meet all the requirements set out in Section 44 of the Medical Device Act 737 and Medical Device Advertising Regulation 2019. So if any, in relation to that, the implementation of this regulation, right, is already started on 4th of May 2021. From this date onwards, if any company, any establishment license, advertising agency, or any person who want to advertise the registered medical device advertisement, they shall apply the advertisement approval from MDA. The full enforcement of this regulation will commence on 1st of January 2022. MDGD 32, this is Code of Advertisement, COA, is to provide the guidance regarding about the advertising code that need to adhere to the advertising a registered medical device. Advertising material should cover, should cover under this COA, including the following listed articles, for example, like internet advertising, marketing, poster, sponsorship, and TV, radio. MDA GL04, this is the guidance to apply for this medical device advertisement permit. All the advertisement to be posted, displayed, or broadcasted shall including the following information. The statement, this statement must be included, registered under Act 737, medical device registration number, and also the advertisement approval number. These are the required documents for advertising permit application. The submission is required to submit to MDA via this manual submission. Each application shall be submitted together with a 1,000 ringgit processing fees, and the processing fees shall be paid through the bank draft. If the authority is satisfied with the advertising application, the authority will issue the approval number for the particular advertisement. The advertisement to be posted, displayed, or broadcasted shall be the same as the approved by the authority. the advertisement approval will automatically to be invalid upon the expiry of the medical device registration. If there are any changes in the claim of the devices as per the registration information, the advertisement will also no longer valid and a new submission is required. Any changes in the content of the advertisement or any new issuance of the same advertisement using other language require a new submission for the approval. Editorial changes and change of picture do not require a new application. However, if the changes are related to the pictorial change that deliver a different message or the claim, a new application shall be submitted. That's all for my presentation today. Thank you.
Zhang's sharing, and I think it's a very important step for those who want to sell their medical product to Malaysia. And if you have any questions for Ms. Zhang, please fill the QA form and she will be glad to answer you in the Q&A time. Now it's going to the last speaker, Ms. Yang, from our Southern Taiwan Science Park Medical Device Operations Center. She will have a brief introduction of our center. Let's welcome her. You can start, Ms. Yang. Hello?
Hello, can you hear me?
Yes, yes. Thank you.
Okay. Thank you, Mr. Oris. And good afternoon, everyone. This is Ms. Yong from Southern Taiwan Science Park Medical Device Department. Today, I will be sharing an introduction about Southern Taiwan Science Park Medical Device Operations Center at Kuala Lumpur, Malaysia. And please allow me to present in Chinese. For Mr. Ahmad Khairuddin, you can refer to the slide and the summary in English versions that I emailed you before this. 大家下午好，我是南科马来西亚吉隆坡医疗器材运营据点的运营人员杨景文，然后很高兴与大家以 YouTube 直播的方式见面，然后非常感谢大家参与今天的线上研讨会。接下来的15分钟，我将向大家讲解关于南科马来西亚医疗器材运营据点为台湾厂商所提供的服务和一些过往的活动分享。首先是地理位置介绍，马来西亚地图可分为马来半岛，也就是西马和东马。南科马来西亚医疗器材据点是位于马来西亚首都吉隆坡市中心，也就是在西马，距离著名的双子塔仅900公尺。然后据点的周边有很多的商业大楼啊、大型饭店、购物商场，然后交通也非常的便利，地铁和轻快铁都能抵达。然后马来西亚的医材据点是与国际牙科诊所 KLIDC 相邻。马来西亚的医材据点是在2019年11月17日正式开幕，然后出席者除了有当地的医疗器材通路商、一些顶尖的牙科学院代表，还有就是从台湾远道而来的成功大学及台北医学大学的医师和教授。台湾厂商呢也有代表在开幕当天呢现场展示医疗产品以及进行牙科工作坊。然后下面大家可以看一下是目前吉隆坡医疗器材运营据点的照片。马来西亚医疗器材据点呢主要有3个不同的功能区。然后红区是派驻人员的办公座位，然后蓝区是台湾医疗产品的展示区，绿区就是教育训练以及课程办理区。 在过去10年间，南科管理局就非常积极的推动医疗器材产业聚落，然后希望可以透过南科平台的服务以及一些研发补助，可以鼓励台湾厂商更多的技术创新，然后向来也取得非常不错的成绩。然后这次希望透过呢，在南向海外的运营据点的建立，可以把南科园区里面以及台湾一些非常高品质的医疗器材，可以带入马来西亚以及东南亚市场。那么为什么会选择在马来西亚建立这个运营据点呢？因为马来西亚的经济发展逐步稳定，然后医疗水准也明显提高，然后吉隆坡市中心也是东南亚经济贸易中心，然后所以马来西亚就成为这个海外运营据点建立的首要选择地点。然后目前呢，已经有15家园区内的厂商进驻马来西亚的据点，然后分别有几个不同的科别，有牙科、骨科、医学美容、智慧医疗、医疗检测服务等。然后我们欢迎更多不同科别的厂商加入，然后目前进驻呢都是免费的。接下来带大家了解一下南科的服务平台，然后先从右上角的人力资源开始。然后马来西亚的医疗据点呢，会有专职的据点管理人员，然后主要是负责据点的日常运营、客户接待啊，还有就是它也是当地的活动主要的接洽窗口。我们的马来西亚据点呢，设有这个办公人员的座位。然后厂商的业务代表呢，也可以在这里办公，或者是可以直接带客户到据点参观，然后可以导入这个体验行销，可以更直接的针对当地的使用者，也就是医师或者是通路商和经销商。那么南科也有协助在当地的人脉发展，比如像连接当地的一些协会机构、医院或者是学府，然后不管是政府单位或者是私立单位，就像我们今天所邀请的讲师，他就是来自马来西亚政府单位投资发展局的代表。接下来我们来看一下关于活动办理这一方面。南科马来西亚运营据点是跟这个国际 KL 牙科诊所KLIDC 相邻的，所以我们可以充分的结合 KLIDC 以及当地的牙科学院的一些资源，然后可以一起合作定期办理各项的专业课程，然后可以让医师更容易的使用到台湾的医材产品作为教材，然后从而可以提升信赖度以及使用度。那未来呢，可以复制这样的模式到其他的市场，并不只局限于牙科。然后厂商呢，也可以借用这个马来西亚的据点场地办理各种形式的活动，比如像是会议课程或者其他相关的推广活动。然后南科也有为台湾的厂商提供法规辅助。像是包括展品进口展示许可，然后当地的法规咨询，还有办理产品取证，甚至是马来西亚周边国家法规，比如像马来西亚邻国新加坡的医疗器材法规咨询。然后不管是哪个风险等级的医疗器材，在进入马来西亚之前，都必须向马来西亚医疗器材管理局，也就是 MDA， 刚才2位讲者也有提到，然后就必须先向 MDA 注册，注册成功之后呢，才可以在马来西亚销售。相信关于注册流程这一方面，刚才Miss Teo 也讲解得非常的清楚。南科在这一方面就会协助台湾厂商连接当地合法的法规顾问公司，比如像 AD System， 然后就协助厂商顺利的办理这个产品的取证。 接下来就是关于这个据点的运营机制，在短期内呢，将会由南科主导，协助台湾厂商的产品进驻，然后还有就是协助他们在当地办理取证，提高这个产品的曝光度，以及增加与当地的医疗器材产业使用者之间的互动。那中期来看，就会南科会协助当地连接就会协助连接当地的一些医学院啊，以及专科医院，然后定期合作办理各种教育课程，然后从中就可以培育当地的医师使用台湾的医疗产品，然后更进一步的强化两国之间的医学交流。那么从长期来看呢，南科将会逐步淡出，然后转由国内就是台湾所进驻的厂商共同主导与运营，然后希望可以组成这个企业团队。好，不好意思，等一下。好，接下来就是南科进驻医材据点厂商呢，目前在马来西亚的市场布局进度图，然后南科在每个不同的阶段都会提供厂商不同类别的协助，比方说像最开始的市场探寻，然后南科可以在这一方面协助做这个资料收集啊、市场调查以及分析，然后接下来就是注册取证，我们可以协助厂商跟当地的那个取证公司、法规公司联合，然后成功取证之后呢，就是要寻找合适的代理商和通销商。比如说像类似今天南科所举办的媒合会，然后可以协助厂商跟当地的医材业者洽谈各种不同模式的合作，然后比如说厂商想要在当地寻找代工厂啊，甚至是建立分行，那么最后就是这个销售阶段，通过各种活动办理啊、参展啊，或者是课程训练，然后希望可以帮助厂商增加这个产品的曝光和使用度，然后帮助争取国际订单。接下来我们来看一下马来西亚吉隆坡医疗器材据点过往的一些活动分享。南科主要是结合国际牙科诊所 KLIDC， 就是办理一些专业的培训课程。那么中间时段呢，都会安排大家参观马来西亚的医材据点，然后由这个据点的运营人员对这个台湾的产品进行介绍，然后同时我们也会邀请厂商目前已经在当地的代理商一起出席活动。像这类型的活动呢，的宣传效益还是非常不错的，因为参与课程的都是医师或者是医学生，然后这样我们就可以更直接的针对当地的使用者来进行这个台湾医疗产品的宣传。另外就是我们也有参与了成功大学马来西亚 Hub 所举办的一个医疗器材线上研讨会。然后在这个活动呢，我们就跟马来西亚大学的教授、成功大学教授以及这个双威医疗中心的医师，针对这个医疗器材的创新与机会进行讨论。然后这个活动也成功吸引了当地的一些研究生以及一些医疗业者的参与。由于马来西亚的疫情的关系，然后有一些线下的课程或者是活动呢，都被改为线上进行。但是由于没有这个场地的限制，每个课程呢都是有接近200位医师以及医学生参与，所以反应还是非常的热烈的。那么在这个网上的 课程呢，我们同样也是在中间时段呢，会安排据点人员针对这个马来西亚的医疗据点以及台湾的医疗产品进行介绍。好，那我的分享就到此为止。让我重点回顾一下我刚才所介绍的南科马来西亚医疗器材据点为台湾厂商所提供的服务，包括人力资源、活动办理、法规取证以及运营机制。而我们期待更多不同科别的厂商可以加入我们。那么目前进驻都是免费的，然后有意的厂商可以跟我们的台湾代表杨廷君联系，询问和了解这个申请流程。那么也可以与我联系，然后我是马来西亚吉隆坡医疗器材运营据点的运营人员。然后感谢大家，然后我把时间交回给主持人。
Thanks for Ms. Yang's sharing. If you are interested to join our KL Operation Center, you can just contact me or contact Ms. Yang, and we are willing to help you in Malaysia market entry. And now, thanks for the speech around the medical device market and the regulatory from Mr. Khairuddin and Ms. Zhang. Now we are going to the Q&A time. And let me check the Q&A form. Maybe I will just choose 2 or 3 questions for each speaker. Okay, there are a few questions. Okay, I gonna start with Mr. Khairuddin. And the question number 1 is Mr. Lee from B company. He says, my company focus on smart medical device with AI and big data analysis which can help doctors' decision. And I need to find a local partner to cooperate. So I need the suggestion from Mr. Khairuddin. Who or what organization should I contact with? Will be easier. Thank you. Okay, Mr. Khairuddin.
Okay, thank you very much for the interesting question. I will love to hear this kind of question coming. The way you are interested to join venture with Malaysian company.
Yes.
So as I said, if your intention is to set up a factory in Malaysia, of course you come to MIDA for advice, and you can contact me directly, or you can contact our office in Taipei. We encourage joint venture between Malaysian and Taiwanese company. So we help you to connect with local Malaysians. We have a division in MIDA that can do the business matching between both companies, Malaysian and foreign. You have to decide whether you want to be 51% or 60-40, it depends on you. It's a business decision. So when it comes to manufacturing project, we do not impose any condition. Because you can own 100% if you want to. If you do joint venture, much better. So we expect if you do the cooperation, the joint venture, we can help elevate our local capabilities. We understand that Taiwan is very strong in AI, very strong in supercomputer. So it's good that we can learn from Taiwan on win-to-win basis, because as you know, Malaysia is I would say a rising star for the medical devices. So many companies are based here in Malaysia to cater for the global market. So we really appreciate very much. If you require loan, for example, we can use a local bank here. We can help to facilitate. Incentive is one thing. Facilitation is another thing that can be accommodated by MIDA. So just email to me or email to Shakila, our colleague there in Taiwan. We'll help you, definitely. Thank you very much. 谢谢你。
Okay, thanks for Mr. Khairuddin's answer. And I found another one question from T Company's Sophie. She says our medical devices are facing the competitions from China and South Korea. As a Malaysian, will you and why you choose medical device from Taiwan? Mr. Khairuddin?
With regard to competition, is the customer's choice. Okay, we do not intervene in your business operation. So if you can provide a competitive price, equality, people will choose yours, regardless whether from Taiwan or from China or Korea or USA. It's a business decision. Of course, everybody is looking for a cheaper one, but better quality. But if you are located in Malaysia, since the cost of doing business here is much cheaper compared to any other countries in the world, and now you provide incentive, you provide facilitation, and the government are so business friendly, I believe there is a plus point for you to consider Malaysia as a hub, regardless whether you have to make Malaysia for your manufacturing hub or trading hub or rep office hub or agent hub. It doesn't matter. We have the conducive investment ecosystem here, not only for investment, business ecosystem here in Malaysia. By our location, we are connected to Singapore, connected to Thailand, connected to all over the world. So I would say with the cost advantage here in Malaysia, it can bring down your price, but not the expense of quality. And Malaysia being, I would say, a reputable country around the world because of our medical devices, I would say, capability. Our local players are good in that. So it brings image for those who make Malaysia as a hub, as a launching pad to penetrate into ASEAN market as well as the regional market. That's my take. Thank you.
Okay. 谢谢. And I found another three questions for Ms. Zhang. And the question one is from C Company's Jeff. He says, as a foreign manufacturer, we would like to launch our products into the Malaysian market. Can you please advise on the procedure and the lead time?
There are two options they can actually consider.
Yeah.
The first option is to set up a local registered entity, and then we can kick off the whole process. It's like GTPMD certification process, and then once completed, then we can apply for MDA establishment license. After successfully obtain the medical MDA establishment license, then we can start on the product registration. So for the total lead time, it will be roughly take about like 3 months time from certification process up to the MDA establishment license. And also for the registration part, the approval lead time is depending on the device risk classification. It will like roughly take about like 3 to 6 months time. So the second option is to select a neutral party or regulatory consulting company to hold your product license in Malaysia. So this will actually save your the timeline for this licensing application. So you will only like once you appoint the local rep, then you can straight away kick off on this registration process. Total is only like 3 to 6 months time for the product to be registered with MDA.
Okay. Thank you. And next question from Ms. Huang. Is there any regulation to approve the COVID-19 related test kit for emergency use? Can you please explain? Thank you.
Okay, recently MDA is actually launched this conditional approval regulation for self-testing kit. We are actually start using these self-testing kit, saliva test kit, antigen saliva test kit since mid of July. It's just like 2 months ago lah. So for all the IVD test kit, COVID-related IVD test kit to be launched in Malaysia is either we need to go through under this special access or conditional approval. Special access is more on the professional use. This conditional approval is only for those self-testing use. So the self-testing kit is allowed to be sold in this pharmacy and approved healthcare facility only.
Okay, thank you. And the last question is from Elaine. She's from G Company. What's the regulation of Malaysia in stem cell MSC application? I think stem cell is 干细胞, right?
对，干细胞。
Yeah.
Stem cell is actually not classified under medical device. It's regulated under MPRA. So probably I send you the related guideline, then you can pass to the person who raised this question.
Okay, thank you.
Okay.
And I think that's all the questions. And thanks for the answer from the speakers. And again, if you are interested in joining our KL Operation Center, you can contact Ms. Yang or can contact me, and we are willing to help you enter the Malaysia market. And it looks like we almost run out of time, so I guess we'll finish here. Thank you for your time and attention. I wish you a happy weekend and holiday. Thank you. Goodbye.
Thank you. Goodbye.
Bye-bye. Thank you, Mr. Khairuddin.
Let's have a group photo.
Group photo? Yeah, sure. Can we have a good photo? Thank you. Okay, bye bye. Bye bye.
再见。
再见，谢谢，拜拜。